Chairman of Basavatarakam Indo-American Cancer Hospital and Research Center, actor, leader, humanitarian, Shri Nandamuri Balakrishna garu to address the distinguished gathering with his opening remarks.
Vagratav Sampartau, Vagratapathapate, Jagatapitaro Vande Bharati Parveshwaro. Good evening to all. It's a privilege and an honor to welcome such an august gathering on this very special occasion. Respected dignitaries, on the dais, Honorable Chief Minister of Andhra Pradesh, Shri Nara Chandrababu Naidu garu, our respected elder statesman Sri Mupparupu Venkaiah Naidu garu, former Vice President of India, Honorable Union Minister of State for Rural Development and Communications, Government of India, Shri Pemasani Chandrasekhar garu, Honorable Minister of State for Health and Family Welfare, Government of India, Srimati Anupriya Patel ji, Honorable Minister for Health and Medical and Family Welfare, Government of Telangana, Sri Damodar Rajanarasimha garu, Honorable Minister for Health, Medical and Family Welfare, Government of Andhra Pradesh, Sri Satyakumar Yadav garu, distinguished guests, doctors, respected former chairmen and trustees, our donors and well-wishers, our dedicated staff, our partners, members of the media and friends from across the world. My warm regards to all of you. Namaskar. Tonight, I stand before you not as an actor, not as a public representative, but as a son. A son who still remembers in 1984, when my mother, Srimati Basavatarakam garu, was battling cancer, we had access to treatment. But what we witnessed around us stayed with us far more deeply than our own struggle. People were not just fighting a disease, they were fighting circumstances. Families were not only worried about survival, but they were worried about affordability. In the midst of her own pain, my mother asked a simple yet powerful question. If we can fight this because we have the means, what happens to those who don't? That was a humble question from a noble heart. And the question became our responsibility. My father, Shri Nandamuri Taraka Ramarao garu, transformed responsibility into a mission. In 1989, he laid the foundation for this institution with an unwavering belief that no life should be lost because treatment was out of reach. Those early years were not easy. This institution was not built in comfort. It was built with commitment, with conviction, with purpose. With deep respect, I remember Dr. Kodala Shivaprasad garu, who was the founder chairman of Basavatarakam Indo-American Cancer Hospital and Research Institute, and Dr. Tulsi Parvati Polavarapu garu, and Sri Kakatiya Venkateshwarlu garu, who stood by this vision when it needed the most strength. I also remember with gratitude all our former chairman, trustees and supporters who carried this vision forward with unwavering dedication. On June 22nd, 2000, the sacred promise became a living reality. The hospital was inaugurated by the then Prime Minister of India, Shri Atal Bihari Vajpayee ji, in the presence of Shri Nara Chandrababu Naidu garu, the Chief Minister of United Andhra Pradesh. That moment was not the opening of a hospital, it was the beginning of a lifeline. For many, it was a hospital, but for thousands, it became a hope. From a modest beginning, this institution has grown into one of India's leading comprehensive cancer centers. Today, we are a 650-bedded world-class facility. Every single day, our team performs 35 to 40 complex surgeries. More than 200 patients receive chemotherapy daily, and our radiation oncology services treat nearly 500 patients a day, making it one of the highest volumes in the country. Over the years, more than 3.75 lakh patients have received treatment here. But let me say this honestly. We have never measured our success in numbers. The true measure of the institution lies in movements. A child who once walked into the hospital with fear walks out with a smile. A child, and the smile is not just a smile. It is a family breathing again. It is fear turning into courage. It is life finding its way back. Our journey has also been strengthened at critical moments by extraordinary support. The Sri Dorabji Tata Trust timely contribution in 2005 because of our the combined state chief minister intervention, chief minister his intervention, Mr. Nara Chandrababu Naidu and the MP lads gave immense movements to our growth, enabling us to build advanced radiation facilities and establish our own our bone marrow transplantation program, which was the first in South India, in India. There is a 12-bedded unit which I had started, which has today grown into one of the most respected programs in the region. At the same time, government support has played a transformative role. Through schemes like Arogya Shri and PMJAY, lakhs of patients have received life-saving treatment. From the bottom of my heart, I express my sincere gratitude to all governments, whether it was the United Andhra Pradesh or today's Telangana and Andhra Pradesh. Every leadership has stood with us, and more importantly, stood with patients who needed it the most. Because cancer is not just a disease, it's a financial, emotional, and generational burden. Many families are forced to sell everything they have, but these schemes have protected them, supported them, and given them a fighting chance. I humbly request continued increased support for such initiatives so that even more lives can be saved. We are not alone in this journey. From large corporate organizations supporting us through CSR, to individuals who gave not because they had more, but because they felt more from inside. From supporters across India to our Telangana, to our Telugu community across the world, particularly in the United States, Australia, and many other countries. Organizations like TANA, Telugu Association North America, and NATS, North American Telugu Society, and many Telugu associations who stood with us time and again. Our fans who responded with trust and stood beside us always. And our partners and suppliers who ensured that world-class treatment remained accessible and humane. Because they understood that behind every effort, there is a life waiting. All of you did not just support an institution. You stood between fear and hope, between illness and healing, between despair and a second chance. For that, we remain forever grateful. Our doctors who fight battles every single day with skill and compassion, our nurses who stand beside patients in their most vulnerable moments, our paramedical teams who ensure precision in every treatment, and our non-medical staff who keep this institution running tirelessly. They do not just a job, they carry responsibility, they carry emotion, they carry lives. Many times they go beyond duty, becoming strength, comfort, and family. To each one of them, I offer not just my thanks, but my deepest respect. Today, as we celebrate this milestone, we also embrace even greater responsibilities ahead. In Amaravati, we are building a 1,000-bed world-class cancer hospital, and in Hyderabad, we continue to expand with advanced technologies and wider reach, and the increase of incidence. Because our belief remains unchanged, the best care should not be out of reach, it should be within reach for everyone. 25 years ago, we made a promise and we kept it. But tonight, we are not celebrating that. We are renewing it. To do more, to reach further, and to stand stronger. With your support, with the dedication of our doctors and staff, and with the blessings of my parents, We will continue this journey until the day no patient is denied treatment because of money, until the day no family has to walk away helpless, until the day cancer is no longer feared but confronted with courage and conquered with care. రోగాన్ని మాత్రమే కాదు, నిరాశను కూడా జయించే రోజు వచ్చే వరకు ఈ పోరాటం ఆగదు. ప్రతి రోగి గెలిచే వరకు, ప్రతి కుటుంబం నవ్వే వరకు బసవతారకం సేవలు ఇలాగే మీ అందరి సహకారాలతో కొనసాగుతూనే ఉంటాయి. థ్యాంక్ యూ. జై హింద్.
Check. Thank you, sir. Thank you very much. On that note, ladies and gentlemen, a leader committed to advancing healthcare, innovation, and public welfare across the state. May I now request Honorable Minister for Health, Medical and Family Welfare, Science and Technology, Government of Telangana, Shri Damodar Rajanarasimha Garu, to share his thoughts.
Respected Chandrababu Naidu Garu, Honorable Chief Minister of Andhra Pradesh, respected Venkaiah Naidu Garu, former Vice President of India, Srimati Anupriya Patel ji, Honorable Union Minister for State Health and Family Welfare, Government of India, P. Chandrasekhar Garu, Satyakumar Yadav Garu, distinguished public representatives, eminent medical experts, cancer survivors, donors, members of the Basavatarakam Hospital family, and esteemed guests. It is a matter of great pleasure and privilege for me to participate in the Silver Jubilee celebrations of Basavatarakam Indo-American Cancer Hospital and Research Institute. I extend my heartfelt congratulations to the Basavatarakam Hospital team for their exemplary services to the society in the field of cancer care. My special appreciation to Sri Nandamuri Balakrishna Garu for carrying forward the legacy of NTR Garu, not only in the cinema but also in the public service and the humanitarian work. His unwavering commitment to upholding the vision of NTR Garu. NTR Garu was not only a legendary actor but also a visionary leader who created history in Indian politics. The Basavatarakam Cancer Hospital stands today as a living tribute to the courage and the inspiration of Srimati Basavatarakam Garu. This hospital is a lasting testament to the foresight, compassion and vision of Sri N.T. Ramarao Garu. For 25 years, this institution has been providing hope, healing and support to lakhs of cancer patients. A distinguished journey of service. Basavatarakam Cancer Hospital has emerged as a beacon of hope and a symbol of trust for cancer patients, providing quality cancer care to lakhs of patients, whether they are inpatient or the outpatient, by offering world-class treatment at an affordable cost. Cancer is one of the most significant non-communicable diseases confronting our society today. Changing lifestyles, dietary habits, environmental factors, and to some extent genetics are driving the rise in cancer cases. Telangana is also facing the steady growth of cancer cases, which is alarming. Cancer causes families to face anxiety, emotional distress, and financial hardship. This reality underscores the need to focus on public awareness, early detection, and treatment. The government of Telangana is implementing a comprehensive cancer policy. Telangana has declared cancer as a notifiable disease. We have established a state cancer registry and a cancer portal to report cancer cases. We have established cancer care centers in teaching hospitals across the district headquarters to ensure that every patient receives quality cancer treatment within their own district. MNJ is declared as a center of excellence in cancer care. The government is prioritizing not only NIMS and MNJ but also the establishment of regional cancer care centers. AI-based robotic surgeries and bone marrow transplant reflect the government's commitment to modern cancer care. Healthcare should not become a financial burden on families, as out-of-pocket expenditure often leads to financial distress. The government of Telangana is implementing Arogyasri with the government of India, which is playing a vital role in providing cancer treatment, including major surgeries and transplants. In this regard, I especially appreciate the services being rendered by the Basavatarakam Cancer Hospital. It is our collective responsibility to serve the society. This Silver Jubilee is an opportunity to renew our commitment for the future of the society, to eradicate cancer. I once again extend my heartfelt congratulations to Nandamuri Balakrishna Garu and his team. Thank you all.
Thank you very much, sir. On that note, I request Chairman Garu to felicitate Honorable Minister Damodar Rajanarasimha Garu with a memento. I request Chairman Garu to present a memento to Honorable Minister Satyakumar Yadav Garu as well. Thank you, sir. Thank you very much. Ladies and gentlemen, we now move on to the felicitation ceremony. Behind every institution that transforms lives are visionaries who dared to dream, leaders who guided the journey, and generous hearts who made it possible. At Basavatarakam Indo-American Cancer Hospital celebrates 25 years of hope and healing. We take a moment to honor our founding members, board members, and valued donors whose unwavering support has shaped this remarkable legacy. Ladies and gentlemen, let us begin the felicitation ceremony. The first batch, may I request Madam Anupriya Patel Garu to do the felicitation and honor the recipients. The first batch of founding board members. May I call upon Dr. Kodala Sivaprasad Rao Garu. On behalf of him, Dr. Kodala Sivaramakrishna Garu will be receiving the founding managing trustee. Ladies and gentlemen, please put your hands together. Trustee of G. Pullareddy Sweets, Shri Raghav Reddy Garu. S. Raju Garu, Sri P. Sitaramuraju Garu, Sri Kommareddy Nagabhushan Garu, Sri Charan Raj Garu, Annalura, శ్రీ శేషిరెడ్డి గారు, మిసెస్ మేఘనా ఇన్ఫ్రా, శ్రీ సుగదీష్ గుడిపల్లి గారు. సమయాభావం వల్ల దయచేసి త్వరగా రావాల్సిందిగా మనవి చేస్తున్నాం. శ్రీ పెండ్యాల పాపయ్య శాస్త్రి గారు, Ramohan garu.
I have requested for this privilege from the chairman of the Board of Trustees of this hospital for 2-3 simple reasons. The first reason is that I am the only surviving founding trustee of this foundation. That is what gives me the privilege. In fact, I had myself forgotten, but I was reminded by the Chief Financial Officer of the foundation that I am one of the 2 or 3 signatories on the trust deed of this foundation. That is one reason. The second reason is many speakers before me have explained how the idea of a cancer hospital has been transformed by Sri late N.T. Ramarao Garu and then followed by the Chief Minister of the then Andhra Pradesh, Sri Nara Chandrababu Naidu Garu. But one thing has not been revealed till now, and I thought I should reveal it for the benefit of all those who are seated on the dais and all those who are assembled. On one fine morning in 1988, I think it was, Dr. Nori Dattatreya, who gave his message via the digital media, he came to call on the then Chief Minister, Sri N.T. Ramarao. And he went and sat with him and conveyed to him that in her last moments before she passed away, Srimati Basavatarakam Garu conveyed a wish to Nori Dattatreya that while she passed away in his hands after proper treatment, something should be done for all the thousands and lakhs of people who contract cancer and suffer immensely from time to time. So Dattatreya suggested to the then Chief Minister that they should do something to perpetuate the memory of Srimati late Basavatarakam. And then the then Secretary of the Chief Minister, P.L. Sanjeev Reddy, who belonged to the IAS, he was the one who suggested to the Chief Minister that the memory of late Srimati Basavatarakam Garu can be perpetuated by founding a cancer hospital. It was P.L. Sanjeev Reddy's suggestion to the Chief Minister that led to the formation of this hospital, and therefore it seems appropriate that we also remember Dr. P.L. Sanjeev Reddy on this very august occasion. And then 10 years passed without any progress. I don't have to, I would have wished to tell a lot about it, but I only tell you one thing, that after laying the foundation stone of the hospital, Sri late N.T. Ramarao Garu left office within 4 or 5 months. And no progress could be made after that. And at one point of time, the successor government suggested that since no progress has been made, the land could be returned to the state government. It was at that stage that I made my humble contribution to this founding of this hospital by taking up the matter with the then Chief Minister, late N. Janardhan Reddy. I sat with him for an hour and explained to him the background of this institution and persuaded him to withdraw all the objections and allow the trust to continue with the work. And then N.T. Ramarao came back to office, and then he reconstituted the board which was responsible for what we are seeing today. I thought with these few words, I should mention these words because these are not known to anybody else except me, who was not only a founding trustee, but I continued as a trustee till 1999. And in early 2000 or late 99, I resigned from the trust to make way for Dr. Tulsi to come into the board. And that is how the whole thing has happened. And I'm very happy that today we see an institution of great excellence which ranks among the top cancer institutions, not only in India, but in the world itself. And with these few words, I thank you, the chairman, for giving me the opportunity to say something on this occasion. Thank you.
Thank you, sir. Thank you very much. And may I now request Honorable Minister for State for Rural Development and Communications, Dr. Chandrasekhar Pemasani Garu, to address the gathering.
Thank you. Praja Sevane Paramavadiga, Anubhavani Ayudanga, Adhikaraanni Badyataga, Andhra Pradesh Pragatiki Batalu Vestunna, Gaurava Mukhyamantri Sri Nara Chandrababu Naidu Gariki, Palle Nunchi Parliament Varaku, Vidyarthi Nayakatvam Nunchi Uparashtrapati Varaku, Poratanto Prarambhamaina Prayanam, ప్రజా సేవతో పరిపూర్ణమైన ప్రస్థానం, తెలుగు తేజంగా భారత ప్రజాస్వామ్యానికి చిరునామాగా నిలిచిన శ్రీ వెంకయ్య నాయుడు గారికి, రాజకీయాల్లో ప్రజా విశ్వాసానికి, నాయకత్వంలో నమ్మకానికి, ప్రజాసేవలో మానవత్వానికి కథానాయకుడైనటువంటి శ్రీ నందమూరి బాలకృష్ణ గారికి, మా సహచరులు Minister of State for Health and Chemicals, Anupriya Patel Gariki, Rashtra Mantri Varyulu, Satyakumar Yadav Gariki, Damodar Rajanarasimha Gariki, Veerito Patiga, Annagari Asayala, Ajaramara Rupam, Sahachara Smurti Nunchi Puttina Sankalpam, Lakshaladi Kutumbala Viswasam, క్యాన్సర్ చికిత్సకు సజీవ సాక్ష్యం అయిన బసవతారకం ఇండో అమెరికన్ క్యాన్సర్ హాస్పిటల్ నిర్వాహకులకు, వైద్య నిపుణులకు, సేవాభావులైన సిబ్బందికి, దాతలకు మరియు ఇక్కడ సమావేశమైనటువంటి మహనీయులందరికీ కూడా హృదయపూర్వక నమస్కారాలు. గొప్ప ఆశయంతో ఎదుటివారి జీవితాల్లో వెలుగులు నింపాలి అనేటువంటి ఆలోచనతో ప్రారంభమైనటువంటి ఏ కార్యక్రమమైనా కూడా విజయాన్ని సాధిస్తుంది, చరిత్రలో నిలిచిపోతుంది. అందుకు మన ముందున్నటువంటి ఉదాహరణలు రెండు. ఒకటి తెలుగుదేశం పార్టీ, మరొకటి బసవతారకం ఇండో అమెరికన్ క్యాన్సర్ హాస్పిటల్. తెలుగుదేశం పార్టీ ఒక ఆత్మగౌరవ ఉద్యమం అయితే బసవతారకం క్యాన్సర్ హాస్పిటల్ ఒక మానవతా ఉద్యమం. తెలుగుదేశం పార్టీ ప్రజల గౌరవాన్ని కాపాడటానికి పుట్టింది. ఈ బసవతారకం క్యాన్సర్ హాస్పిటల్ ప్రజల ప్రాణాలను కాపాడటానికి పుట్టింది. రెండింటి వెనుక ఒకే మహానుభావుడు అన్న నందమూరి తారక రామారావు గారి దూరదృష్టి, మహోన్నత సంకల్పం, గొప్ప సేవాతత్వం ఇందులో ఉంది. తెలుగువారి ఆత్మగౌరవం కోసం ఆవిర్భవించినటువంటి తెలుగుదేశం పార్టీ 40 సంవత్సరాలుగా ప్రజల హృదయాల్లో నిలిచింది. తన జీవిత భాగస్వామి అనుభవించినటువంటి బాధను మరే పేద కుటుంబం అనుభవించకూడదనే సంకల్పంతో ఆవిర్భవించినటువంటి ఆసుపత్రి 25 సంవత్సరాలుగా లక్షలాది మందికి ఆశాకిరణంగా నిలిచింది. క్యాన్సర్తో బాధపడుతున్నటువంటి కుటుంబాలు ఎదుర్కొనే ఆర్థిక మానసిక కష్టాలను దూరం చేస్తూ పేద మధ్యతరగతి ప్రజలకు కూడా అత్యాధునిక ప్రపంచ స్థాయి క్యాన్సర్ పొందాలనే, చికిత్స పొందాలనే లక్ష్యంతో ఈ సంస్థను ఆ రోజు ఏర్పాటు చేశారు. ఈ సంస్థ గొప్పదనం ఏంటంటే ఆ రోజు ప్రధానమంత్రిగా ఉన్నటువంటి అటల్ బిహారీ వాజ్పేయి గారు కేవలం ఈ ఒక్క హాస్పిటల్ ఓపెనింగ్కి మాత్రమే వచ్చారు అంటే అది ఆ రోజు అన్న నందమూరి తారక రామారావు గారి మీద కానీ నారా చంద్రబాబు నాయుడు గారి మీద కానీ ఉన్నటువంటి ఒక గౌరవం, అభిమానం అని ఈ సందర్భంగా నేను తెలియజేసుకుంటా ఉన్నాను. అయితే ఆశయం ఒక్కటే ఉంటే కేవలం ప్రారంభం మాత్రమే అవుతుంది. అయితే ఆచరణ ఉంటే మాత్రమే అవి ముందుకు వెళుతుంది, తరతరాలకు ఆదర్శంగా నిలుస్తుంది. బసవతారకం వంటి ఆసుపత్రి మహోన్నత సంస్థలు 25 సంవత్సరాల పాటు విజయవంతంగా ముందుకు సాగినా ఈరోజు ఈ చుట్టుపక్కల ప్రాంతంలో హైటెక్ సిటీ అభివృద్ధి చెందిన, బయోటెక్నాలజీ రంగం వికసించిన, ISB IIIT వంటి సంస్థలు అంతర్జాతీయ స్థాయి గుర్తింపు పొందినా అవి యాదృచ్ఛికంగా జరిగినటువంటి విజయాలు కాదు, కాలం కల్పించినటువంటి అద్భుతాలు అంతకంటే కాదు. ఆలోచనలను ఆచరణంగా మలిచిన కార్యదీక్షకు, నిరంతర పర్యవేక్షకు, అంకిత భావానికి సజీవ సాక్ష్యాలు. ఆ సజీవ సాక్ష్యాలకు నాయకుడే తెలుగు జాతి ఎప్పటికీ నిలబడి ఉండే, రుణపడి ఉండే శ్రీ నారా చంద్రబాబు నాయుడు గారు. 100 పడకలతో ప్రారంభమైనటువంటి ఈ ఆసుపత్రి ఈరోజు 650 పడకలతో, 225 పడకల ఆరోగ్యశ్రీతో, 250 మందికి పైగా వైద్యుల సహకారంతో, దేశంలోనే మొట్టమొదటిసారిగా 12 మడకల బోన్ మ్యారో ట్రాన్స్ప్లాంట్తో, 3 లక్షల పైగా అవుట్ పేషెంట్లకు వైద్యం, 90,000 మందికి పైగా ఇన్పేషెంట్ చికిత్సలు, టాటా రీసెర్చ్ సెంటర్ తర్వాత 8,000కు పైగా అత్యధిక సంవత్సరానికి శస్త్రచికిత్సలు అనేక రకాలుగా ముందుకు వెళ్తా ఉన్నారు. పేద వర్గాలకి ఆరోగ్యశ్రీ, ఆయుష్మాన్ భారత్ పథకాల ద్వారా వేలాది మందికి ఈ రోజున ఉచిత వసతి, భోజన సదుపాయాలతో జరుగుతూ ఉంది. కేవలం ట్రీట్మెంట్నే కాకుండా ఇందా చూపించినట్టుగా ఈరోజు స్క్రీనింగ్కి మొబైల్ యూనిట్స్ని పెట్టారు. అత్యాధునికమైనటువంటి యంత్రాలు, అంటే దాదాపు 6 లీనియర్ యాక్సలరేటర్, ఒక్కొక్క లీనియర్ యాక్సలరేటర్ 30 కోట్లు, 6 ఉన్నాయంటే అవే 180 కోట్లు. పెట్ స్కాన్, ఇలా అత్యాధునికమైనటువంటి యంత్రాలతో ఈరోజు చికిత్స నిర్వహిస్తూ ఉన్నారు. అదేవిధంగా ఎంతోమందిని తయారు చేస్తూ ఉన్నారు ఈ రోజున, పారామెడికల్ సిబ్బందిని కానీ, నర్సింగ్ సిబ్బందిని కానీ. ఈ విధంగా క్యాన్సర్ అంటే ఈరోజు గుర్తుకు వచ్చేది బసవతారకం. ఎందుకంటే నేను కూడా గుంటూరు పార్లమెంట్ సభ్యుడిగా ఉన్నాను. నా నియోజకవర్గంలో ఎవరైనా సరే నన్ను అడిగే క్యాన్సర్ రిఫరల్ సెంటర్ బసవతారకం మాత్రమే నేను మీ అందరికీ తెలియజేస్తా ఉన్నాను. ఈ సంస్థ నాట్ ఫర్ ప్రాఫిట్గా పనిచేస్తూ ఉంది. వచ్చిన ఆదాయం మొత్తం మళ్ళీ ఆసుపత్రి అభివృద్ధికి ఈ రోజున పెట్టుబడిగా పెడతా ఉన్నారు. బయట కార్పొరేట్ హాస్పిటల్తో పోలిస్తే 30 నుంచి 40% తక్కువ ధరకు ఈరోజు వస్తూ ఉన్నాయి. అదేవిధంగా ఈరోజు ఇక్కడ ప్రారంభమైనటువంటి ఆసుపత్రి గౌరవ ముఖ్యమంత్రి గారి ప్రోద్బలంతో ఈరోజు రేపు అమరావతిలో కూడా 21 ఎకరాలలో దాదాపు 700 కోట్ల రూపాయలతో 1000 పడకలతో మొదటి ఫేజ్ 500, తర్వాత 500 పడకలతో అమరావతిలో కూడా ఇటువంటి సంస్థ రాబోతా ఉంది. అయితే ఆఖరిగా ఆస్తులకు వారసులు చాలామంది ఉంటారు, కానీ ఆశయాలకు వారసులు కొందరే ఉంటారు. తల్లి రుణానుబంధాన్ని, తండ్రి సంకల్పాన్ని నిలబెట్టిన అరుదైన తనయుడు ఎవరైనా ఉన్నారంటే అది శ్రీ నందమూరి బాలకృష్ణ గారు. ఈ ఆసుపత్రి అభివృద్ధి కోసం నందమూరి బాలకృష్ణ గారు చేసినటువంటి కృషి విశేషమైనది. నేను రాజకీయాల్లోకి రాకముందు అమెరికాలో ఉన్నాను. వీరు విదేశాలకి తన సినీ సాంస్కృతిక కార్యక్రమాలకు వెళ్ళిన ప్రతిసారి ఆ ప్రయాణం వెనుక అభిమానులను కలవాలనే ఉద్దేశంతో పాటు బసవతారకం ఆసుపత్రికి మద్దతు సమీకరించాలనే తపన కూడా ప్రత్యక్షంగా చూసినటువంటి వ్యక్తిని నేను. ఒక కళాకారుడిగా కాకుండా ఒక కుమారుడిగా, ఒక ట్రస్టీగా, ఒక సేవకుడిగా ఆయన ఈ బాధ్యతను నిర్వర్తిస్తూ ఉన్నారు. ఎందుకంటే ఈ స్థాయి సినీ వైభవం, ఈ స్థాయి ప్రజాదరణ, ఈ స్థాయి సిరి సంపదలు ఉన్న వ్యక్తికి ఇవన్నీ చేయాల్సిన అవసరం లేదు. అయితే తండ్రి నాటిన మహావృక్షానికి వారు ఈరోజు నీరు పోస్తూ ఉన్నారు. బాలకృష్ణ గారి అంకిత భావం, దాతల సహకారం, వైద్యుల సేవాభావంతో ఈ బసవతారకం హాస్పిటల్ మరింత ఉన్నత శిఖరాలకి తప్పకుండా అధిరోహిస్తుంది. ఇది ప్రేమకు అంకితమైనటువంటి ఒక పవిత్ర క్షేత్రం. 25 సంవత్సరాల క్రితం నాటిన ఒక సంకల్ప బీజం. ఎందుకంటే ఇది బాధలో ఉన్న వారికి ఒక భరోసా, నిరాశలో ఉన్న వారికి ఒక ఆశ, జీవితం కోసం పోరాడుతున్నటువంటి వారికి ఒక కొత్త అవకాశం. ఇలాంటి సంస్థను ముందుకు తీసుకువెళ్తున్న అందరికీ కూడా నేను మనస్ఫూర్తిగా ధన్యవాదాలు తెలుపుతా ఉన్నాను. వీరే కాకుండా ప్రత్యక్షంగా పరోక్షంగా సహకరిస్తున్నటువంటి నారా బ్రహ్మణి గారు, మా సహచరులు భరత్ గారు, అదేవిధంగా రామ్మోహన్ నాయుడు గారు ఈరోజు రాలేకపోయారు. వారు కూడా సందేశాన్ని నా రూపంలో ఇవ్వమన్నారు. ఎందుకంటే వారికి అమిత్ షా గారితో గ్రూప్ ఆఫ్ మినిస్టర్స్ మీటింగ్ ఉండి రాలేకపోయారు. నా సందేశము కూడా వారి సందేశమే. కాబట్టి ఆఖరిగా ఆ రోజు షాజహాన్ తాజ్మహల్ ప్రేమకు సాక్షిగా ఎలా కట్టి ఈ రోజుకి గుర్తు ఉందో, ఈ బసవతారకం హాస్పిటల్ అన్నగారి ప్రేమ సాక్షిగా చరిత్రలో నిలిచిపోవాలని కోరుకుంటూ నన్ను ఆహ్వానించిన మీ అందరికీ కూడా మనస్ఫూర్తిగా ధన్యవాదాలు తెలుపుకుంటూ సెలవు తీసుకుంటున్నాను.
థ్యాంక్ యూ సార్, థ్యాంక్ యూ వెరీ మచ్ ఫర్ దట్ ఇన్స్పైరింగ్ అడ్రస్. చైర్మన్ గారిని మెమెంటోతో సత్కరించవలసిందిగా మనవి చేస్తున్నాం. శ్రీ డాక్టర్ పెమ్మసాని చంద్రశేఖర్ గారికి సత్కారం. వెంకటేశ్వర స్వామి మెమెంటో. Thank you, sir. Thank you very much. Ladies and gentlemen, it gives us great pleasure whose contributions to strengthening healthcare and public welfare continue to impact lives across the nation. It's indeed a privilege and honor for Basavatarakam Cancer Hospital and Research Institute for having the Honorable Minister of State for Health and Family Welfare and Chemicals and Fertilizers, Government of India, Srimati Anupriya Patel ji. अभी हम अनुरोध करते हैं आपका संदेश और मार्गदर्शन करें.
Honorable Chief Minister of Andhra Pradesh, Shri Chandrababu Naidu ji, former Vice President of India, Honorable Shri M. Venkaiah Naidu ji, Honorable Union Minister of State for Rural Development, my colleague in the Parliament, Shri Chandrasekhar Pemmasamy ji, Honorable Minister for Health, Medical and Family Welfare, Government of Telangana, Shri Damodar Raj Narasimha ji, Honorable Minister for Health and Family Welfare and Medical Education, the Government of Andhra Pradesh, Shri Satya Kumar Yadav ji, Trust Board Member Shri Bharat Mathu Kumili ji, Honorable Member of Parliament, and the Chairman and Managing Trustee of the Basavatarakam Indo-American Cancer Hospital and Research Institute, the man who's brought us all here today, Shri Nandamuri Balakrishna ji. All the eminent guests who are present here today on this occasion, distinguished members of the medical fraternity, cancer survivors, our friends from the media, ladies and gentlemen, a very good evening and namaskar. I have great delight in joining you all today for the Silver Jubilee celebrations of the Basavatarakam Indo-American Cancer Hospital and Research Institute, an institution which stands as a shining example of compassionate care, dedicated service to humanity, and social commitment. On this momentous occasion, I convey my heartfelt greetings to the trustees, to the management, to all the dedicated team of doctors, the entire staff, the donors, and every other key stakeholder who's contributed immensely in this remarkable journey of nearly 2.5 decades. Congratulations to all of you. We all know that the sufferings of late Srimati Basavatarakam ji, who lost her life to cancer, became the inspiration for establishing this institute. And as I understand, the vision of late Dr. N.T. Rama Rao ji, the then Chief Minister of the state, was not merely to build a hospital, but to create a center of excellence which would ensure affordable and quality cancer care to every section of the society, particularly the underprivileged ones. And over the last 2.5 decades, I am happy to note that the institution has built an inspiring legacy where it combines advanced medical treatment and technologies with a strong commitment to both affordability as well as inclusivity. And the fact that a large number of the patients or the beneficiaries, they come from the economically weaker section of the society, it reflects the true spirit of service. I am particularly pleased to note that the institution has evolved into a comprehensive cancer care center with not just advanced treatment facilities and research capabilities, but also pediatric oncology services, palliative care, and most importantly, extensive community outreach programs. The contribution of the Institute towards cancer screening as well as building awareness, particularly in the rural and the underserved areas, demonstrates that healthcare institutions can play a transformative role beyond the hospital walls. Friends, cancer today has emerged as a significant public health challenge for our country. And in India, we have roughly around 15 lakh new cancer cases every year. While the advancements in the medical technologies and treatments have improved the rate of survival and the patient care outcomes, the burden of cancer continues to rise. And there are several factors behind it. The changes in the lifestyle that has come, the environmental factors, several factors which govern this continuous rising burden. And the real challenge that lies before us today is not just in providing affordable and quality treatment, but in preventing cancer and also in detecting cancer at an earlier stage. Because the entire medical fraternity understands that if you detect cancer early, it can improve the rates, the chances of survival. And Government of India has recognized cancer treatment as a key public health priority. We have a dedicated national program for the prevention and control of the non-communicable diseases, especially cancer, and comprehensive services are being provided, which includes everything right from prevention to screening to diagnosis, treatment, follow-up, and palliative care. All that is being strengthened across the length and breadth of the country today. And I'm also very proud to state here today that India has undertaken one of the world's largest population-based screening programs through a network of nearly 184,000 primary healthcare facilities, now called the Ayushman Arogya Mandir, across the length and breadth of the country, where every Indian citizen who's aged 30 years and above is being screened free of cost for 3 types of common cancer: oral cancer for both men and women, and breast and cervical cancer screening for women of this country. And I must commend the good work that our frontline healthcare workers are doing in building awareness and also ensuring timely reference and treatment of these patients. This population-based screening program that we have started through our Ayushman Arogya Mandir, it has today been able to screen more than 35 crore individuals for oral cancer, 16 crore women for breast cancer, and nearly 9 crore women for cervical cancer. And we would all understand that cancer, when detected timely, can help to a great extent in reducing not just the economical, but also the emotional burden on the families, especially those which are the less privileged sections of the society. And besides strengthening the screening and early detection services, Government of India has also scaled up the infrastructure across the country. So through our state cancer institutes, our tertiary cancer care institutes, our expanded oncology services which are now being provided in the new medical colleges that have come up. And we have really built many medical colleges in this government. There has been a huge scale up. Before 2014, we had around some 384 medical colleges. Today we have 820. So all these medical colleges today have these oncology services, and also the new All India Institute of Medical Sciences that have come up. We have 23 AIIMS now in this country. So everywhere, the infrastructure is being scaled up and these services are provided so that we bring cancer care closer to the communities, to the patients. And we also realize that financial protection becomes very important insofar as cancer care is concerned. The flagship initiative of Government of India, which you may have heard about or read about very often by our leaders, Pradhan Mantri Jan Arogya Yojana. This is an initiative under which eligible patients, and you would be happy to know that there are 62 crore individuals in this country, which includes the bottom 40% of the poor population, which includes the elderly citizens who are aged 70 years and above, our frontline healthcare workers, and also the gig workers. These 62 crores individuals, they all come under the purview of the Pradhan Mantri Jan Arogya Yojana, and under this scheme, all the eligible cancer patients are receiving support for treatment. Additionally, Government of India has launched initiatives like the Pradhan Mantri Jan Aushadhi Pariyojana and the Amrit Pharmacy stores, which are ensuring that the essential anti-cancer medications are now available to the general public at much lower rates as compared to the market prices. Prevention, ladies and gentlemen, remains our most powerful weapon in our fight against cancer. And here I would like to mention about the very recent initiative which was rolled out by none other than the Honorable Prime Minister of India, Shri Narendra Modi ji. And that is the HPV vaccination for our girls, for our daughters who are aged 14 years. And nationwide in all the government health facilities, we are doing the HPV vaccination to provide protection against the most deadly cancer, the second most common cancer which is causing death of women and girls in this country, cervical cancer. In all the government health facilities, this HPV vaccination is being undertaken. And we have a cohort of around 1 crore 20 lakh girls who are 14 years of age, and the program started, the vaccination started in the month of February, and by now, almost 44 lakh vaccinations have been achieved already, and the program is really picking up. In all the states, people are coming forward to ensure that their girls do get the free of cost vaccine, HPV vaccine, which is being provided by the Government of India. And we want to reduce the number of preventable cancers. Tobacco consumption, that is also something we have taken up on priority. We're building awareness and trying to discourage people to consume tobacco because it becomes one of the major reasons why people get exposed to the risk of cancer. So these are various steps Government of India has been taking to protect its people. However, the most important thing is that the future of cancer care in India is going to be shaped by innovation. And I'm proud to say that India is already embracing this opportunity. Artificial intelligence, digital pathologies, advanced molecular diagnostics, and several indigenous advanced medical technologies are today helping to improve screening, diagnosis, treatment, as well as follow-up. We have initiatives like Diamonds and several other research programs through which affordable, high-quality diagnostic services are being promoted, and at the same time, the vision of a self-reliant India and Atmanirbhar Bharat in healthcare is also being advanced. And I believe that institutes like the Basavatarakam Indo-American Cancer Hospital and Research Institution, they've got a big role to play in this mission. With what you're doing, whatever I have understood in the audio visuals and by listening to so many of the speakers before me, that the institute is really complementing the efforts of the government insofar as screening, early detection, treatment, and follow-up along with palliative care is concerned. And you have your next phase of your journey wherein you have your plans of expansion. We also heard that a new institute is coming up in Amravati. So I wish you all the best. And I hope that the coming years would see more and more contribution of this institute in providing comprehensive cancer care to the citizens of this country. So friends, let us work with a renewed determination to build an India where comprehensive cancer care is accessible for each and every patient, an India where every patient receives timely treatment, an India where preventable cancers are reduced not just through awareness building, but also by the promotion of adopting healthy lifestyles, and an India where innovation drives better patient care outcomes for our future generations. And with this, I once again convey my heartiest greetings to the Institute, the Basavatarakam Indo-American Cancer Hospital and Research Institute, on completing its 25 glorious years of service to humanity. And I do hope that you will continue to illuminate countless lives with hope, healing, and compassion. Best of luck to everyone who's associated with the Institute, and thank you very much for having me here. It's been great knowing about the Institute. Thank you very much, all of you, for being such a patient audience. Jai Hind.
Thank you, Madam. Thank you very much. I request Chairman Garu to present a memento to Honorable Minister Anupriya Patel Garu. Ladies and gentlemen, we now move on to the second batch of felicitation ceremony. We thank all our CSR associates, partners. Thank you very much. And